Well, we know you've heard this before. It's flu season, so get your vaccine and wash your hands. Right now, doctors say people are dying from the flu, and they're seeing symptoms at record rates.
Yeah, the CDC information shows this week that about 5,000 people have died from the illness this season alone. New data. 10 Tampa Bay News reporter Annie Krall hears how this year is a very different story.
He says he has no appetite whatsoever.
That's how Sarasota resident Manuel Chipote would describe his friend Peter after the man in his 80s got diagnosed with the flu about 3 weeks ago. He learned on Monday that Peter's wife Mary also has the flu and is now in the hospital.
Peter has lost 8 pounds and Mary has lost 10 pounds. Mary is weighing now at 98 pounds. And she was not very heavy to start with.
Not an uncommon story as cases spike nationwide. As of December 27th, the CDC estimates there have been at least 11 million flu cases with at least 120,000 hospitalizations across the country. Dr. Stephanie Reynolds, an emergency room physician at HCA Florida Sarasota Doctors Hospital, said an atypical strain is partially why people who got their flu shot are still getting sick. The aggressive strain is impacting children and sending them to the hospital with pneumonia.
When a child is breathing, if you can see their ribs or their movement of their chest or their collarbones sink down, those are very ominous signs and you need to get to the hospital. Your child is having respiratory distress, possibly pneumonia from the influenza.
Visits to the doctor for fever plus a cough or sore throat, common flu symptoms, are at the highest levels since the 1997 to 1998 flu season.
Doctors say once your fever or your child's fever reaches 104 or even 105 degrees Fahrenheit, you should certainly come to the emergency room before things get any worse.
Influenza historically has been a huge killer in our society. It takes people away at a younger age and at an older age. The risk of death from complications from influenza is there.
Annie Krall, 10 Tampa Bay News.
All right, I want to put this up on the screen too to make it easy for you because it is kind of confusing. Symptoms to watch out for so you know whether you may have the flu, COVID, or just allergies. According to the National Institutes of Health, if you have a fever, that's almost always the flu. Secondly, if you have difficulty breathing, it's most likely COVID. A headache with other symptoms likely give away that you actually have the flu.
Those are